Hi, my name is Sandra. I had cataract surgery and I went to Vision Scotland in Aberdeen.
So earlier this year we looked after Sandra. She came to us with really a lifetime of really poor vision and needing very strong glasses from an early age, from early childhood in fact. I think she talked to various specialists in years gone by, and they'd either recommended against getting anything done or just said it wasn't possible. And of course, you know, you see a specialist, you listen to their opinion and you accept that as fact. More recently, it was suggested to her that something could be done.
When I went to see my optician recently this year, I explained to him that I had a problem with my left eye, that I had like a bit of a haze on it. So he did some tests and he advised me that I had the forming of a cataract. So he advised me, because I was such a high prescription, a minus 17, 18, that I might be better to go and see somebody at Vision Scotland and see what they could do for me.
She came to see us and what came across in the consultation was that she was struggling to believe that it was possible, and she wanted to know what had changed, that the advice she'd been given in the past was no longer the case. And she's also very worried about having treatment.
I was so anxious. I had so many questions. With me having such a high prescription, I was like concerned that I was going to go blind, that I was, you know, what happens if something goes wrong? She
had a lot of concerns that we discussed with her. You know, obviously there are some risks with surgery, and you know, we don't shy away from that fact. We talked about those and what we would do if any problems arose, and about the fact that actually, you know, significant risks are actually very rare. So there was quite a lot of psychological adjustment to coming forward for treatment, and feeling comfortable having treatment, and recognising that this was a positive thing to do and might actually make a really big difference to her life.
I remember asking him, have you ever performed surgery on somebody with such a high prescription like I have? And he started laughing and he says, yes, worse than you. And I thought, oh well, that's fine. If somebody else has got a worse prescription and he's managed to fix their eyes, he can fix mine. The day of surgery was amazing. I went in there and I was as cool as a cucumber. I wasn't anxious, I was just wanting this done. I went in, everybody spoke to me, from the receptionist right through. I went in, I got drops put in my eyes, lots of drops.
Surgery was actually very straightforward in the end, not really much to talk about. She was an excellent patient, really good patient, and her reaction straight after surgery was, it was that sort of penny dropping moment where you kind of think, oh my goodness me, I never believed this was possible. Everybody said it wasn't. I've thought that for decades, and I'm sitting up now, and it was possible, and I can see it, and I can't believe how quickly I can see and how well I can see.
I thought that after the operation that my eyesight would be gradual, that every day would be, you know, I'd see a bit more. No, I got sat up and I could see. I was flabbergasted. I was like, oh my, oh wow, wow.
Oh, this is amazing. Good. Oh, wow. Oh, wow. Oh, wow. Oh, thank you very, very much.
I think her reaction to surgery and her early recovery period really exemplifies to me not just the wow factor of getting vision correction, and it really was quite a big deal for her, but just trying to get your head around the fact that these things are possible, and that something which you've sort of come to believe your whole life couldn't be done can be done. It's just such a big change, and you really see that when you see Sandra talking about her recovery from surgery and how she felt about things.
I could see people. I could see the figures and writing on their t-shirts. I could see people in the distance. I could see all the instruments. I could see, I just couldn't believe it. I can do things and I can see things I've never seen before. Colours are vibrant, clearer, brighter. I can see for miles out that I'd never seen before. I can stand at my house and go, wow, look at that. Oh, wow, look at that. I mean, for somebody that can see, it's fine. But for somebody that's been so short-sighted all their life, to eventually not have to fiddle about with a pair of contact lenses in the morning or a pair of glasses in the morning, and my life's changed greatly. My advice to anybody that's in the same position as me, go and have a consultation with Vision Scotland. Go and ask them questions. Write down what all you think about your worries, and then go and speak to them, and you won't regret it. You really won't regret it. They are so helpful. So it's like family. It's like going in there and your family. I have been gifted by meeting these people, and everybody is so friendly, warm, even from the receptionist right through to everybody in the theatre. Vision Scotland staff are amazing. They're like family to me now.